So a tool that I like to use, and I like to get women using it in the prenatal period just to start thinking about it, is the NESTS tool. So that's nutrition, exercise, sleep, time for self, and supports. So nutrition, it was already covered in this prenatal series, and nutrition is also important in the postpartum period. When we're nourished and we're taking care of ourselves, we feel better, we're healthier. So all those same principles apply. If you're breastfeeding, you're going to be burning more calories, so it's really important that you are making time to eat, and maybe that means you get someone to help you with that, reminding you, here's a snack, you need to eat, you're forgetting to eat, you're so preoccupied with baby. Exercise releases endorphins that make us feel good and lifts our mood. And as we saw from that pregnancy guideline on exercise, there was a 25% reduction in depression for those women who were able to maintain a regular exercise routine. Sleep, and I can't stress sleep enough. When we are sleep deprived, we don't cope as well. And that goes for anybody, not just new moms. So it's so important to look at ways to get sleep. You might have to be creative with that, and sometimes some women may even need a bit of help by going to their doctor, midwife, and talking about how they might be able to get even just a chunk, like 5 hours of sleep can make you feel like a whole new person when you've been going just constantly on very, very little sleep. Time for self. Now, I'm not saying that you need to go away for the weekend and leave your brand new baby. I'm looking at just 5 to 20 minutes periodically throughout the day. That could look like having a nice hot bath or shower in the morning. That could look like going out onto the porch and having your cup of tea. It could look like going for a walk with a friend for 20 minutes in the neighborhood and just getting a break, taking that time, doing what you love, reading a book, sitting, listening to music, maybe it's journaling. Those are examples of time for self, and taking that time is so important as well. And it's good for you because it fills your bank. So when we fill our bank as mums, it helps us to then better care for our babies. And support planning is talked about in this prenatal period, or prenatal series, sorry. So again, review that, look at who those supports are, and identifying those who maybe are not such good supports and trying to limiting that. Being aware of these perinatal signs of depression, anxiety is so important. Take a look again. If you're feeling that way, get your partner to read through it. But sometimes you might need a medication, and medication can be a tool. So that's where your doctor midwife come in, and that might be necessary for some women if the symptoms are not going away or they've gotten worse. And to not be ashamed of that. Medication can be a tool to help you get through this period of time in your life that you're going through. And I want to point out a resource. It's called the Pacific Postpartum Support Society, and that's a great text, online, telephone resource. There's videos of women who talk about their lived experience with postpartum depression, anxiety, as well as someone you can talk to. And these women that you talk to have actually lived the experience of this as well. You can also reach out to your doctor, midwife, your public health nurse, community services, community outreach workers for this as well. A practical way to use the NEST tool in helping support your mental well-being is to make small goals. So goals really need to be specific and achievable. We're not looking to conquer a marathon. We are looking to make a small goal when it comes to exercise. So what you could say is, this week I plan to exercise by going for a walk 3 times for 20 minutes, and then write it down and hold yourself accountable to that. We can check in with you, your partner, depending on who you've worked with to set that goal. Somebody can check in on you and see how you went. With that, another goal might be sleep. This week, I plan to take a nap every day in the afternoon when baby naps, and see how that goes for you as well. and really working towards making these goals realistic. You're not expecting that you're going to sleep through the night because you have a newborn baby at home. You're not expecting that you're going to go away for the weekend with time for self. You're going to set small achievable goals that you might be able to work your partner into this as well. How could your partner help you to get to that goal, or a friend or a support person? I really want to share that as a nurse and as a mom, I walked through this journey. I was teaching prenatal and working with moms in the postpartum period as well. But becoming a new mom was not as easy as I anticipated. And definitely reaching out to these supports that are available to you, and just want you to know that we're here. We're here to help you. As an RN, I'm part of that team, as well as the other players.